And please, our time is fast spent. We need to be out of this place in 35 minutes and have a 25 minutes presentation to make. Would you like to recognize another of my colleague here, Mr. Livelihoods of Belem. God bless you. Thank you very much. Once again, let me appreciate my speakers and guests who have taken time to be here. Comrade Azuzu, Mr. Taiwo, Your Royal Highness, Dr. Belem, and my brother Charles. I thank you all and members of. Today, we're looking at enhancing blue economy activities through climate smart livelihoods. Next slide, please. And quickly, let me just give you a brief background of who we are as an organization. Noise Across the Borders was founded as far back as 1999 as a global NGO, and we are an international non-profit organization. Our interest is on sustainable health care and empowered communities. Our vision is community shaping health outcomes, and our motto is expanding the frontiers of healthcare. Next slide, please. Our objective and strategy is to shift from disease treatment to health promotion, preventive, curative, and rehabilitative services, and professional responsibility and capacity building. This we do by empowering healthcare professionals, nurses, doctors in exactly what we do here. We are an NGO. As an NGO, we are collaborating with international bodies, and our approach is prevention plus community care and systemic reform. Next slide, please. Now, what have been our major achievements and milestones? We have been advocacy with the UN. We've been involved with the UN since 2001. In fact, we're one of the first NGO to be accredited to the 2002 United Nations Summit on Sustainable Development in Joburg, South Africa. Out of 807 NGOs all over the world, we were one of the first to be admitted to participate. We have been involved with the HIV and AIDS program. As an NGO, we collaborated with the Nursing Council in Nigeria to build the capacity of nurses and midwives in the period where people were running away from HIV. So we trained them on prevention and management of HIV. We've been involved with the UNFCCC since COP 10 in Buenos Aires in Argentina. That was 2004. And up until date, we've been there and we'll still continue. And as mentioned, we're the first NGO to be granted observer status by the UNFCCC in Nigeria. At COP, what was significant is that at COP 15 in Denmark, 27 NGOs came together with the WHO. Because before now, there was just one single line statement about health. But at COP 15, Noise Across the Borders with 27 NGOs with the WHO formed what they call the Friends of Health. That was when they campaigned to make health as a driver and as a topical issue for the climate change discussion started. From COP 15 to COP 16, up until date in 2022 at Sheikh or Egypt, that was at COP 27. Health was declared a thematic issue by the UNFCCC. That had been a struggle from 2009 up until 2022, but all glory to God for that. And so we are an NGO with executive status in 2005, and we have been board members of the Conference of NGO in collaborative relationship with the United Nations. That is all the NGOs under the UN as a board as Congo. Noise Across the Border was a board member from 2011 to 2017. And as of today, we have memorandum of understanding with the Federal Ministry of Health. We have MOU with the Delta State Oil Producing Development Commission. We have MOU with the Federal University of Petroleum Resources, and then we have MOU with the North American Council of Nigeria, with the World Continuing Education Alliance, and with Data Flow. Now, our MOU with the Federal Ministry of Health is twofold. We are technical partners with the Federal Ministry of Health on climate change, and then by virtue of our diaspora engagement, because we are involved with Nigerians in diaspora organization, Europe, we were able to lead the Federal Ministry of Health with international organizations that have been involved with ethical migration. And that is the fact that the migration of health workers from Nigeria across the board is not ethically managed. And so last July, we made it possible for the organizations that are responsible for such activities in the Philippines and India to enter into an agreement with the Federal Ministry of Affairs. We're actually working on that, and we just developed the draft MOU on that. And we have amazing building programs for nurses and healthcare development on mitigation and adaptation strategies. On global networks and collaboration, we are a member of the Global Climate and Health Alliance. We're also a member of the Global Network of Civil Society Organization for Disaster Reduction, that is JDRO. We are a member of the Global Consortium of Climate Health Education, Secretariat of the Civil Society Network of NGOs on climate change in Nigeria. So part of our community development is with Nigerians in diaspora, as I mentioned. So Noise Across the Borders was the only NGO that took part at the Ocean Conference in Senda in 2015, and then in 2022 and 2022 that was at the United Nations Ocean Conference in Lisbon. We were the only NGO that had an activity there. Then in 2025, we were in Paris at the United Nations Ocean Conference, the third Ocean Conference. There, we had a side event. Next slide, please. It was that side event that led, our side event was health and climate change, the nexus in the marine and blue economy strategic policy pathways for a just transition. And that event, that was where we announced that in COP30, we're going to launch what we call the Health Ocean Climate Nexus Framework. And that is why we are here today. And what led to this? Because the diagnosis that we found out was that human health is oceanic health, and oceanic health is climate stability. And when gas flares poison children's lungs in the Niger Delta, those same toxins acidify the Gulf of Guinea. When rising sea flood in Dakar slum, cholera follows. Yet our prognosis remains hopeful. Rigorous evidence confirms that strategically integrated policies can break the cycle. And so we try at that event to dissect the problem of the climate, ocean, and health crisis. You see, Africa suffers 4 to 7 times the global mortality from climate-linked diseases despite minimal emissions. Vector-borne diseases surge. Malaria incidence in East African highlands rose 37% from 2010 to 2024 due to warming, reversing decades of progress made by the WHO. That was the WHO report 2025. Heat-related mortality, hospitalization for heat stroke in Sahel regions increased 214% since 2018, disproportionately affecting pregnant women and infants. That was the last count in 2024. Nutritional collapse, crop failures from erratic rainfall elevated severe child wasting rates to 28.1% in the Horn of Africa, the highest globally. That was according to the UNICEF in 2025. Now, what is the connection? That is the ocean health nexus. What the unseen epidemic. Africa's marine ecosystem sustained 120 million people, not now critically compromised. Fisheries collapsed. Fish stocks declined 40 to 60% along West Africa's coast since 2000, causing a 22% rise in the reduction in the fishing communities. Toxic seafood. Mercury levels in Ghanaian fish exceeded WHO limits by 800%, causing developmental disability among coastal newborn. Now, pathogen explosion. Viral bacterial infections increased 300% in Tanzania after coral die-off disrupted natural filtration. Next slide, please. So, at the end of that event, that was when we announced to the United Nations this event. Please click on that. And the United Nations accepted and adopted our program that we intend to launch today. It's going to be a program that is going to last from now till 2030. Just click on the link, please. Yes, take it off. That is United Nations adopting our program. That is enhancing blue economic activities through climate smart livelihoods, which is what we're launching today. Up, please. And so, please go. So that was the program that we launched today, and it was announced at the United Nations Ocean Conference. Let's go back to the slides. Now, next slide. Next slide, please. Yes. Now, how do we intend to go about this? These are our detailed intervention and components. So we intend to go through this through a binding protocol requiring 3 pillars. One is joint vulnerability assessment, using the WHO Climate Tech Vulnerability Index with the National Oceanic and Atmospheric Administration's Ocean Stress Indicators. We intend to deploy 500 NOS-led fit teams to map coastal water toxicity and chart new development outcomes. Then to also check the sea temperature rise and link it to diarrhea prevalence. Step 2 is to integrate data into African Union's continental early warning system. And funding, we're looking at funding from G7 Climate Reparations Fund, targeting about $120 million per year. And now pillar 2, in terms of our binding protocol, is cross-ministerial budgetary integration. 3 ministries should be involved in this: the Health Ministry, the Environment Ministry, and the Ministry of the Fishery Ministry. So if these ministries contribute 45%, 10%, 25% as part of the annual budget into these activities, that will take us a long way. Next slide, please. Now, have been practiced before now? Yes. In Kenya, the Kenya resources model, whereby they redirected $47 million from oil permits to solar-powered health clinics. They have 38 units built. Now, they also spent for that money mangrove restoration about 6,200 acres, reducing flood damage to clinics by 70%. Now, what is our framework? The NOS deployed early warning architecture. We intend to do this by one, through climate health sentinel programs. We try to train health workers using the WHO curriculum that has 6 models: ocean toxins, preventive health, heat stress triad protocols, disaster mental health first aid, marine biology surveillance, community-led mangrove restoration, policy advocacy for health and climate justice. Now, notice across the borders collaboration with the Colombian Global Consortium for Climate Change Education, which is a global partnership. We will use this advantage to tap on the expertise of these professionals to help us develop and build the capacity of our various health workforce. So we intend to deploy about 100,000 nurses by 2020. That is 1 per 5,000 coastal residents. How do we do this? We are looking at working with Climate Earth Africa. We can begin to look into developing a Nurse Link app that will be reporting fish case events through trigger toxin screening. Next slide, please. Now, partnership and stakeholders. This meeting today is intentional because if you look at the speakers that are here, it's a collaboration of the major stakeholders in this. We're looking at, we have the Nigerian Congress, we have the Nigerian Maritime National and Safety Agency, we have my colleague from the civil society, we have the ecosystem, and then we have the presidency represented here today. Because we need to come together to be able to bring about the needed resources and expertise to execute this project. And we also have local partners, that is the Fishers Women's Group Youth Association, regional, that is the African Union, West African Coastal Institutions, international UN agencies, NGO, government and private sector. Next slide, please. Now, what are the expected outcomes and justification for this project we are launching today? Now, not across the border binding commitment, that is 2025-2027. Number 1, we intend to have 50,000 ocean climate health diplomats using the WHO UNEP certified nurses deployed to coastal clinics. Now, Nexus Equity Index, that is, we begin to rank nations based on their health budget integration, on the percentage of their health budget integration. Then we also based also on coastal ecosystem recovery by hectares and the climate disease mortality reduction. So now by 2026, we want to have a million nurse march, that is to create the awareness by global mobilization for the NICE Ocean Action Plan certification. We're looking at maybe about $20 million plus into coastal economies within 5 years. 10,000 new jobs will be created, and restoration of about 20,000 acres of mangrove, so that is 100 kilometers proactive, improve climate resilience and health surveillance. Next slide, please. Now, our call for collaboration. So we are inviting funders, we are inviting UN agencies, we are inviting government, NGOs, and partners to partner with us, and we're looking out for grants to finance this advocacy. Why join? Because it is scalable, it is health-centered climate. The truth of the matter remains that the only way by which the success of any climate change campaign can be measured is its impact on your health and my health. And so your success can be measured by the amount of buildings that you're going to save. If there are climate change disasters, the first climate change response is the number of lives that will be saved from those climate disasters. Next slide, please. So there will be monitoring and reporting through indicator will be through training, jobs, income and ecosystem recovery. We'll have quarterly and annual community report feedback and multi-stakeholder review system. Next slide, please. Now, what are the risks and mitigation? Environmental, financial, governance, and social risks and mitigation, sustainable practices, diversified funding, coordination frameworks, equitable and benefit sharing. Now, what legacy has been that we will leave behind? In this project, if embraced by all, is a long-term community capacity building. It's institutionalizing nurse-led early warning with integrating nexus model into national climate plans and scaling across Africa coastal regions. Next slide. In closing, our service is to humanity, and climate justice is equals will lead us to a healthy equity. Ladies and gentlemen, in line with our pledge at 2025 United Nations Ocean Conference in Paris, I hereby formally launch the Health Ocean Climate Nexus Framework at COP 30. So the presence and involvement of the Nigerian World Congress, the MASA, Federal Ministry of Health, the Supertech, FUPRE, and other international collaborators is a reality that collectively we can improve the livelihoods of our coastal communities and their health. Thank you for your time, and God bless you.